Hi guys, Mark here from the Brick office. We have Oscar here as our patient who's had ACL reconstruction about close to a month ago now. We're into the program, the PT program, for 2 weeks, so he's fairly new into the rehab protocol. He had a reconstruction using an allograft for his right knee, and that's what we're going to be trying to help him with throughout the course of our video. So we're going to be showing you, little exercises here and there after every week, so that we can show his progress through the whole ACL program. So one of the few things that we have to address at the initial kind of like weeks of surgery or after the surgery is the amount of motion or restriction that the person might have. So for him, he came in with the severe restriction of extension and flexion of the knee, as would be expected after the surgery. So the one effective way to help with that is to just prop the heel up and the leg up this way, and we'll put weights on the top of the knee, just superior to the patella, and let it sit there for a good 5-10 minutes, depending on what the patient could tolerate. We've been doing this for about a week now. We started off with 5 pounds, and now we have progressed to about 10 pounds, and we'll hold this for 10 minutes to improve with the extension of his knee. So for the next one, we'll try to improve his knee flexion. Essentially, it's how we bend the knee. One of the exercises that we try to do with that is to have the patient sit at the edge of the bed, and we'll just kind of like grab the patient's leg here, stabilize here, and just gently push it as far as you could without any pain and to the patient's tolerance, and hold it for a good 10-15 seconds prior to us moving it back. So this is a passive exercise to just improve the knee flexion of the affected limb. So another thing that we need to consider when we're doing the program for ACL or any other knee surgeries, the mobility of the patella. One way for us to get that moving is to just do this patellar glides technique. It's essentially just moving the patella in and out and up and down, so that it has more mobility for when the knee is able to move better. So one technique that we can do is to just place our hands, the web of our fingers here. We see the patella would be here, and we could just like glide it up and down, and superior inferior glide, and we do the mediolateral glide, which is also important, moving the kneecap that way and towards me. So we'll do that for a good minute or so, just to get that kneecap moving around, so that the knee is able to move as much as it can. Hi guys, one of the things that we can also do if we want to improve the extension of the knee, especially in functional activities, is to do what we call like the retro walking, and we're going to use to step over the cones to improve on the knee flexion as well, going back and going forward. So Oscar here is going to demonstrate how to do that, coming back and coming forward, focusing on improving the knee extension when he's in that position. All right, Oscar.
So on the opposite side of the railroad track, the apartments down
there. Right, there will be the extension of the knee. Extension of the knee. Coming forward, when he puts his heel down, he's forcing his knee to extend as well. And just like that. Once we have better control with how the quads is functioning, we can do standing exercises involving close kinematic chain activities, like step-up exercises. For this one, we're just going to do straight up forward step-up to facilitate the quad contraction. And we're going to try to demonstrate more of how the quads is acting coming up and going down. All right. For this one, we're gonna try to do the 6-inch steps for the activity. All right.
Take stance that are not canceled out. Like, when I go through the machine, you'll see when it goes over.
Control going down is important as well. Control going up is also essential. You can see he has a good control of the quads when he's coming down and he's going up. And that's what we want for this exercise. Alright, so as a progression of the stepping exercises, we'll be doing the step down, which is a little bit more difficult than the step up. It requires more control from the quads to facilitate the recruitment of the muscle itself. So he's going to be coming down from a 6-inch step, focusing on controlling the knee bend when he's stepping down with the left foot forward. Okay? All right. Good. And coming back up, controlling, making sure that the knee is completely extended when he comes back up. Control and back up. So as we progress through the program, we want to challenge the knee a little bit more, and one way to do that is to have the patient do unstable surfaces activities like, excuse me, the BOSU. So he can do just a sustained squatted position in the BOSU and hold that position, like what he's going to do right now. It's good. And we can also do medicine ball presses while he's maintaining the squatted position in the BOSU.
So sorry, I have a quick question.
Okay. Or we can do the perturbation exercise while he's in the squatted position, like what I'm going to do right now.
I appreciate you.
And then we can also do the ball catches with the medicine ball in the squatted position with the knees, right? Transitioning into the running phase later on, we'll try to do quick steps using the cones, and Oscar is going to demonstrate to us the stability that we require for the knee to have before we progress to, you know, the running program. All right, Oscar, go ahead. Just do a couple more cones just to progress that along. Go ahead. With the cones, we're doing dynamic stability exercises for the knee, and Oscar is going to demonstrate to us the crisscross pattern with the THERABAND on. He's been doing this for a while now, and he's fairly great. That's why we're doing the black THERABAND with it. All right? As you can see, you can have good control on the knee. It doesn't go side to side when he's stepping, and that's what we want. Okay, now we're seeing a better stability of that knee doing the previous exercises. So as part of our ongoing program, we would try to have him just do like a little jog just to see how it does and how he feels, and then we'll take it from there. Okay, go ahead, Oscar. So you can see, he has a good stability on that knee while he's doing it. So later on, we'll get him doing more of the agility program. But for now, it's good to see that he's almost back to where he was before.
Once we establish a better dynamic stability of the knee, we could start doing some light cutting activities like what Oscar's going to do now.
So advancing through the program, we can definitely do cone exercises with coupled with the agility drills. And then we'll do some jumping activities too. And doing some ladder drills as well. So later on in the program, you know, the therapy would be focusing on just refining and fine-tuning the skills that we've achieved for activity-specific or sports-related goals. So there you have it. Those are some of the activities and exercises that we typically do for ACL reconstruction surgeries. You know, but understand that they're not the same. Not all ACL reconstruction surgeries are the same. Really depends on what graft is used or what other structures might be involved with the initial injury itself. So I would strongly advise for one to consult a rehab professional just for a proper exercise progression and just to guide through the process of recovery safely. We hope that this video gave you an idea of what one of the many things that we do here at Thompson Healthcare and Sports Medicine. In behalf of the BRIC office team, I want to thank Oscar for being a great patient, and I want to thank you guys for watching.